Good morning. I am Dr. Prashant Mulya. I will be speaking on lumbar canal and intervertebral foramen. So objectives of my today's talk is I will be introducing you about the lumbar vertebra, and I will be speaking mainly on the boundaries of intervertebral foramen, its structures which are entering and exiting the foramen, lumbar canal, its recess, and the content of the lumbar canal. To start with, the lumbar vertebra has the larger body and the quadrangular spine with the transverse process projecting laterally, and the lamina which are non-overlapping with the superior and inferior articular process projecting from the junction of the pedicle and the lamina. The ligaments which are supporting the lumbar vertebra are anterior longitudinal ligament, posterior longitudinal ligament right here, the supraspinous ligament right here, interspinous, and the ligamentum flavum, which could be seen in this sectional profile. Let us have a look over these two major ligaments, the ligamentum flavum and the posterior longitudinal ligament. The ligamentum flavum extends from the facet joint capsule from its medial margin to the point where the two lamina fuses, leaving a gap in the midline for the passage of internal vertebral venous plexus or the communication of internal vertebral venous plexus with the external vertebral venous plexus. This ligamentum flavum joins these two lamina. So it attaches along the inferior margin of the superior lamina on its inner surface and superior margin of the inferior lamina on its outer surface. Next is the posterior longitudinal ligament, which is broader towards the cervical and the thoracic region, but it is denticulate in shape, dentate like here, along the lumbar region, which forms a narrower band in the midline and the broader on the sides in the region of intervertebral disc. Let us come to the intervertebral foramen. This intervertebral foramen has the following boundaries. Anteriorly, it is the posterolateral aspect of the upper body and posterolateral aspect of intervertebral disc, with the small part contributed by posterolateral aspect of the lower vertebra. Posteriorly, it is the facet joint capsule, and superiorly, it is the inferior vertebral notch of the superior vertebra and superior vertebral notch of the inferior vertebra. To revise again, the structures which are forming the boundary are posterolateral aspect of the vertebral bodies, superior and inferior part, and intervertebral disc anteriorly. Posteriorly, it is the facet joint capsule. Superiorly, it is the inferior vertebral notch, and inferiorly, it is the superior vertebral notch. This intervertebral foramen is directed laterally, and it is closed in the recent state by the psoas major muscle. So in this section, we can see the psoas major muscle closing the region of intervertebral foramen. At a point, you may see few ligaments extending this along this intervertebral foramen. They will be called as trans-foraminal ligament. Okay, the structures which are passing through this foramen are the spinal nerve. If we are talking about L1 and the L2 vertebra, the L1 spinal nerve will be passing along this foramen. The other structures which we can see are a recurrent meningeal branch of the spinal nerve, a spinal branch, you can see here the spinal branch of the lumbar artery which will be running along the sides of vertebral body, and the spinal branch will be going within this intervertebral foramen. Once inside, near to the intervertebral foramen, they divide further into 3 branches. One is towards the centrum or the body. So this branch is called as a post-central branch. The one is towards the lamina. So it is called as a pre-laminar branch here. And the other one is towards the spinal cord. That's the radicular branches. So these 3 branches will be passing through the intervertebral foramen. Intervertebral venous communication is seen communicating intervertebral venous plexus with internal vertebral venous plexus with the external vertebral venous plexus. You can see the intervertebral veins which are passing along with the spinal vessels. Okay. Let us come to the lumbar canal. The vertebral canal, it extends right from the foramen magnum to the sacral hiatus, which occupies the lumbar column curvatures. It is broader and triangular in the region of cervical and in the region of lumbar. For the clinical purpose, this lumbar canal, for this clinical purpose, it is divided into 3 zones. So one in the center and the other 2 on the sides. The center is called a central zone and the lateral zone on the sides. The central zone will be lying between the medial margins of the articular facets. Between this medial margin of the articular facets lies the central zone. The lateral zone, which passes through the intervertebral foramen, is further divided into 3 parts as subarticular, which is just beneath the articular process. So it is called a subarticular or the lateral recess. Foraminal, which is passing through the foramen, and extraforaminal, which is passing beyond the foramen. So thus the lateral zone is divided into subarticular, foraminal, and extraforaminal. The lateral zone, which I explained right now, is the space for the spinal nerve. So it is also called as a root canal. Let us go with the boundaries and the content of this lumbar canal. To see the boundary of the lumbar canal in this sectional profile, we can visualize. On the anterior side, it's the body intervertebral disc of the lumbar vertebra supported by the posterior longitudinal ligament. On the sides and on the posterior aspect by the pedicle and the lamina, which are fusing together. The adjacent lamina, which are held together by the ligamentum flavum. So these structures forms the boundary, which shows the opening on the sides called as an intervertebral foraminal. The structures which are present or the contents of this lumbar canal are the spinal cord and the cauda equina. The terminal end of the spinal cord, which is called as conus medullaris, is present in the first lumbar vertebral foramen. And in the lower lumbar vertebral foramen, you'll find the cauda equina. The other structures surrounding the meninges are vertebral venous plexus with the longitudinal communications or anastomotic channels of the spinal arteries and the fatty tissue along with the lymphatics. Thank you.